Hi everybody, thanks for subscribing and welcome back to Footsteps to Fertility. Today we're going to be talking about PID. If you don't know what that means, stay tuned. I'm Dr. Wanjiro Ndegwa and you're watching Footsteps to Fertility. PID. PID basically means Pelvic Inflammatory Disease. Big words for something that's quite simply put. I wanted to share this because I've had a lot of questions about PID recently. I'm sure some of you have had a scan that shows PID when it's not really PID sometimes, or have had the diagnosis of PID and are just wondering, okay, what is PID? So what pelvic inflammatory disease basically means is that you have infection that has spread to the whole pelvic area. And for women, what the pelvic area is it's our birth canal, it's our cervix, it's our uterus, tubes, and ovaries. Yeah, so that's, and has gone into actually the abdominal cavity. So that's PID. What causes PID? PID is basically caused by infections, which are called sexually transmitted infections or sexually transmitted diseases. And these are chlamydia, gonorrhea, some other bacteria that are just a mixed infection, or it could be TB. And it's important to note that TB is rampant in our setting. And so if everything else fails in terms of investigations, it's always good to look out for tuberculosis. I want to differentiate STI from candidiasis because I've had people who say, yes, I have an STI, and I'm like, okay, describe it. And they describe something that we call yeast infection or candidiasis. It's not the same thing. And I want to differentiate the difference between an STI and a yeast infection, because I've had people who tell me, yes, I have an STI, and when I question, I ask more questions, they say, yeah, it's this whitish discharge that's curdy and it keeps coming back, and I'm like, no, that's not an STI, that's yeast or candidiasis. It's very common in women. Another differentiation is a UTI. That's a urinary tract infection. That also confuses some people. Urinary is in the front where we have the urethra. That's where we urinate from. That's infection that has ascended into the bladder and is in the bladder. So it's not in the birth canal. So they're very different from an STI, STD. So what are some of the symptoms that you should be looking out for if you think you have an STI, like chlamydia and gonorrhea? One of the most common symptoms is that you have a lot of lower abdominal pain. You have intense pain in your lower abdomen, and it's like cramping. Sometimes it's a burning sensation, and it doesn't go away. It keeps coming and sometimes becomes worse. Another symptom is a heavy PV, pervaginal discharge. So you have a lot of discharge that could be either colored or not colored, but it's a lot in amounts, and most of the times it has an unpleasant odor, and it's really different from your normal. So when you get those two symptoms, you should think, okay, maybe I have an STI, and you should go and see a gynecologist. The other things that you could look out for are either some abnormal bleeding between the menstrual cycle, so that could be a sign, or you could have painful intercourse. But not all painful intercourse is because of PID, but it's an important sign that should tell you, okay, I need to go get a checkup. Other things, if it does spread too far, the other symptoms could be that you even get an appendicitis. If the PID or the infection spreads to the appendix, then you'll get symptoms of an appendicitis. So you could have pain on the right side that is severe. You could get fevers and chills. You could get really, really sick. And this is the stage where it has gone too far. And it's important to note that. We also have ectopic pregnancies, where it's pregnancy in the tubes or in other areas of the body that are caused by PID. That occur when you have PID, sorry. So that also is something that you should look out for. And why am I talking about PID? I mean, what's its relation? It's important to note that PID is the most common cause of infertility in our setup. Because what does it do? It causes our tubes to block. Yeah, and if our tubes are blocked, then we're not going to be able to conceive. So it's really important to guard yourself against sexually transmitted infections, which will lead to PID. And the other thing that it can cause is that chronic pelvic pain. So if you have pain that's niggling and is always there in your pelvis and you're wondering, I'm always feeling pain in my lower abdomen, it's not before a menses or after a menses, it's not cyclic pain, it's not at a certain time, it's just always there, it could also be PID. So my message today is that, young girls or even people who are looking to conceive, please guard yourself against these infections. And it's quite easy. I preach abstinence if you can do that. If you can't, please protect yourself. Use a condom, yeah? Use a barrier method, because it's not all about pregnancy. There's HIV, there are all these STIs that could tamper with your future fertility. So please, let's be careful. So if you liked this video, share with a friend who may have a problem or may need to have this information. Subscribe to our channel. We are on YouTube, we are on Facebook. Send us a Twitter message as well. I mean, we'd always like to hear what you have to say. Inbox us. Let's engage. Yeah. I'm Dr. Wanjiro Ndegwa, and you're watching Footsteps to Fertility, where we walk with you.